Collecting payments from patients can be one of the more challenging tasks when working at the front desk of a medical practice. However, most patients do understand that some degree of payment is expected at the time of their visit. In derm clinics, determining the correct amount to collect at the time of service can be complicated due to the nature of our specialty. Our patients frequently undergo multiple procedures, such as biopsies or freezing, in addition to their routine consultation. Cosmetic services can also be overlooked during checkout, particularly if they weren't the primary reason for the appointment. For example, a patient might have made the appointment for just a routine skin check, but during the visit, the provider performs several biopsies and a cosmetic procedure. If this information isn't communicated to the front desk before the patient checks out, the patient might leave without first settling those additional charges. To facilitate smoother payment collection, several measures can be taken before and during the patient's visit. First, when able, we should verify the patient's insurance benefits and eligibility before they come in for their appointment, and also confirm if there are any outstanding balances. When the patient arrives, we should always collect flat-rate copays and any unpaid balances. Copays are usually required for office visits, but not for procedures or surgeries. Exceptions can occur depending on the patient's insurance plan, so clarify what the copay covers to avoid misunderstandings. Some practices streamline collections by keeping a credit card on file for patient balances. Find out from your practice manager and coworkers whether or not this is an option in your clinic. If it is, just know that storing credit card information should only be done if specific security protocols are followed. Patients should also consent to allowing their credit card information to be kept on file, and you'll need to explain to them how their card will be used. Maintaining a strong line of communication between the back office and checkout is crucial to prevent situations in which patients leave the clinic without paying for all charges due. Ideally, medical assistants should escort patients to the checkout desk to finalize payments and book their next appointment. Once a patient leaves the office, recovering unpaid balances becomes much more difficult. And the longer a balance remains outstanding, the less likely it is to be collected. This is why collecting payment at the time of service is so important. When presenting charges to the patient, we need to provide a clear explanation of those charges and avoid phrasing requests for payment in such a way that might suggest that payment is optional. For example, instead of asking, "Would you like to pay your copay today?" it would be better to ask, "How would you like to pay your copay today?" This subtle shift in language can make a notable difference. There will inevitably be situations in which a patient cannot pay their balance in full. Find out from your practice management what types of options, such as payment plans, are available to patients who find themselves in that situation. Those who work at the front desk and checkout are generally not free to decide on their own which payment alternatives are available to the patient. So be sure to find out your practice's policies regarding financial hardship. Remember, if patients hear slightly different versions about payment requirements from each staff member they encounter, this can only lead to confusion and distrust. Consistent messaging among staff is critical to delivering clear and uniform information to patients.